So I was working on a big research, not actually a research study, it was a digital health pilot project in Tanzania, using community health workers to deploy digital tools to pregnant people. So using these workers to visit pregnant people in their home and really help them get connected to healthcare services in rural and more urban parts of Tanzania. And so that really excited me because I saw how they were able to just collect so much data through this as a byproduct of the program. And I was excited about using that data to better understand the program, help them improve all these women that they were visiting in their homes, help them improve their health for both themselves and their babies, and then using that data actually to do some predictive modeling to kind of identify which of those women might end up with an adverse outcome or which of those women might need some additional care. So that was kind of my foray into kind of taking the science research side into like actual implementation in digital health. And after that, I was kind of hooked. So I stayed in the kind of area of research. I was a data science fellow at the Harvard Data Science Initiative during my postdoc, doing a lot of different areas of research focused around digital health. That's also when the COVID-19 pandemic started. So again, really interested in using data to figure out how we can understand healthcare utilization, again, in the United States and globally. What Delfina does is we are a pregnancy care platform. We partner with obstetric care clinics, so clinics that are giving prenatal care to individuals during their pregnancy. So we partner with those care providers to help them identify patients that will go on that might develop complications and then prevent them from occurring. So as part of this platform, we not only integrate within the kind of electronic health records at the system to pull out all of the kind of data insights that we need, but we also have a patient-facing app that supports the patient throughout their pregnancy journey. We also have doulas that connect with the patient throughout their journey, really make sure that they're engaged in their care, that they're getting any other like social and emotional support that they might need. And then we also do have some nutritionists and lactation consultants and mental health specialists on our team that for those patients that need kind of additional support above the doulas and above what they're able to get at their clinics, that they're able to have telehealth consultations with them. So we view Delfina as a system of care, and we are proactive. So we're trying to identify people kind of before the complications occur so that we can prevent it from happening.
So Delfina does it pull in the relevant data from the various systems and the
Yes,
records?
yes, exactly. So
Very cool. Oh, I love that. But
That's
just
why
for
you want the
pregnancy.
patients and the providers involved, because then you can get
exactly.
all the records from everywhere compiled.
Exactly. And this, I mean, is a major problem, as you probably heard
Oh
in health,
yeah.
right? Like all of our different data systems, competing EHR systems, like some places don't even use electronic health record EHR systems yet. And so really finding a way to centralize all that information, that's what our team spends a lot of time doing, is like from all these different clinics, how do we pull in information and make it make sense? And then
Mhm.
we also get information from our patient app. And that's kind of we use that almost as a way to kind of fill in the gaps that exist in these EHR systems. Every patient that's enrolled in Delfina Care, like they are entering through our patient app. We have like extreme like data privacy settings. We don't share anyone's data. And so I was a little worried like about that side of things too, like just really making sure that patients feel that their data is protected, especially in this environment. So I think we had a lot of early conversations about that in 2022. And like as a company, kind of coming together to really make sure that patients felt safe using Delfina and entering data through that to support their pregnancy.
I saw that. I know, like, I saw health plans, I saw employers, you've got the providers, you've got the patients. So you've created kind of
Everyone.
this, yeah, you've
Yeah.
created this great kind of maternal health support ecosystem, find your way into the door one way or another, you can get in.
Yeah, exactly, exactly. And I think it goes back to the just being flexible and like understanding that, yeah, not every patient's the same, not every practice is the same, not every provider is the same. And that the other interesting thing for me is when I've seen our system be used at different clinics, that I would think of the clinics as roughly the same, similar patient population, like they're even using the same electronic health record system. But depending on the clinic, like they might have their medical assistants more involved in Delfina. The OBs might be the ones directly reviewing everything, or the MAs might be reviewing some stuff in the Delfina system before. And the way the front desk staff also interact. I've just been really interested in the dynamics of a clinic and then how that all like those different players might interact with Delfina as well.
Yeah, you mentioned not having health insurance before you get on Medicaid, where you then qualify for it because you're pregnant.
Yep.
And like I was saying, pre-ACA, right, was my world. And it's a great opportunity to say that like we need to take better care of our people. Like we shouldn't be showing up at the 11th hour, you
Yeah.
know? So,
Yeah, exactly. And this is what I've heard also from our health plan partners is they feel so reactive, like they
hmm
want to be proactive. So they want to be able to prevent these things from happening or know who doesn't have transportation to their medical appointment so that they can get it to them,
right.
or know who experiencing food insecurity so that they, because health plans do have a lot of resources to connect patients to, but they feel like they're always reactive, like, oh, the baby's in the NICU, okay, now we have to react and try to like improve outcomes from that point. But if the care had started before all of this, maybe you could have prevented that NICU admission.
hmm
So I think that's why health plans are excited about Delfina, because we really like that is our whole thesis is being proactive, um, avoiding being reactive at all costs.
Yeah.
And I think that's where we need to go with healthcare across the board, is
Oh,
really
yeah.
focus on prevention instead of like waiting for something bad to happen and then treating someone.
This has been a Shut Up production.
Shut up!